Hi, my name's Matt. I'm a student at the University of Southern Queensland. In this presentation, we're providing student nurses who are learning about nursing communication strategies just a short explanation of what is included in nursing progress notes. Later on in the presentation, we will explain how aspects of person-centred and family-centred care can be used alongside the grief and loss framework to guide transition care for an elderly Aboriginal patient. Nursing students must become proficient at writing nursing progress notes. To become proficient, they must familiarise themselves with the non-verbal and verbal communication components contained within nurse progress notes. Additionally, the application of person-centred and family-centred care and the grief and loss framework are particularly useful in assessing elderly patients who may need to transition into aged care facilities. So why is it important to write nursing progress notes? Good clinical record keeping should enhance communication between healthcare professionals and enable continuity of care, which basically means that when a nurse writes good progress notes, they will communicate the patient's condition effectively and ensure the patient's health is improving and not deteriorating. So why is the grief and loss framework so important in addition to nurse progress notes? Well, in this particular scenario, as you'll see in the next slide, the grief and loss framework should be applied because of the sudden death of a loved one, which compromises a person's health. As can be seen by research by Catherine Keyes et al., there is a significant relationship between the onset of psychiatric disorders and the unexpected death of a loved one, especially in older adults with prior history of mental disorder. Okay, so this is a standard nursing progress note. When we talk about documentation standards, we mean the actual legal requirements for documentation in each state, correctly identifying the label and information of the patient is important, writing in black pen, the chronological order, that is the order of correct date and time using 24-hour format, is seen in both these places. Writing needs to be legible. The nurse needs to put a line through any blank space so that nobody else can add information to the nurse progress note. And finally, the nurse needs to print her name, put her designation, RN, registered nurse, and then sign the nursing document. So this is a completed legal note. We've highlighted the verbal and non-verbal communication within the nurse progress note, and also underlined the grief and loss aspects of the nurse progress note, and put in bold the crisis point for the patient losing his wife, and the aspects of grief and loss. Okay, so next we have the SOAPy format of the nursing progress note. Notice we have the crucial information, the subjective and objective information highlighted, communication highlighted. In orange we can see that the nurse has made the assessment, that the patient has been assessed to be within normal parameters, which implies the patient does not need any dramatic intervention or complex care plan. From the health records of Mr. Perkins, it's important that he eats more food and is hydrated so that his physical health does not deteriorate any further. Giving him privacy and a cup of tea and savoury scone given, and also intervention phone given to the patient to make a call to his son Michael. There's been planned for his care. The patient was consulted regarding his medical needs and consented to the plan for care. And finally, the review by the aged care assessment team has been made, and his current condition has been evaluated. This is an evaluation step of the SOAPy format and a necessary stage to assess Mr. Perkins' readiness for transition into, say, aged care, where his needs can then be better serviced. So what are some of the positives and negatives of the non-verbal and verbal communication and grief and loss framework? Well, the positives are consistency of non-verbal documentation. These avoid stuff like medication errors or transfusion errors. Use of the SOAPy documentation method will ensure good record keeping, so that's a positive. Experiencing the death of a spouse during life is associated with increased risk of developing debilitating mental health problems. Well, as a result of recognising the grief and loss, The patient, Mr. Perkins, is now in his first steps to recovering and hopefully a journey towards improving his circumstances. Some of the negatives of not using verbal and non-verbal and verbal documentation is that the health professionals might be held accountable for the death or deteriorating condition of a patient. Consequences of using electronic documentation these days mean that SOAPy notes can become quite large, and they risk burdening the health professional if the data is not useful. Another negative, nurses may consider grief and loss framework but leave out the patient's cultural perspectives. So what is the person-centered care or family-centered care in relation to the grief and loss in this scenario? Well, we acknowledge the transgenerational and pervasive effects of individual and collective loss in the Aboriginal and Torres Strait Islander community. The loss of land, spirituality, land and language, and the loss of male role models through incarceration is a massive grief and loss area for Aboriginals. Nature of bad news and sorry business further complicates grief and loss because of the obligation of going to dying persons' funerals. So how do we use personal-centered care and family-centered care? Well, we respect Mr. Perkins' values, needs, desires and personal beliefs, which is standard person-centered care philosophy. We respect his cultural differences and we encourage and facilitate Mr. Perkins to contact his family members and involve them in the plan of care for Mr. Perkins. By using the grief and loss framework, we can frame Mr. Perkins' transition into aged care. We need to discuss the impact of Mr. Perkins' losses with his family, any elders, the aged care assessment team, aged care facility and counsellors to plan his transition into aged care. And counsellors are particularly important in this situation because of the state of Mr. Perkins' mental health. An Aboriginal counsellor would be preferred as they can relate to him a lot better. We need to listen to Mr. Perkins' feelings and what he is experiencing and empathise with his losses. This is patient-centred care. We also need to use family-centred care, communicate with his family and find out potential ways of obtaining Mr. Perkins' views about his future care. In conclusion, by using non-verbal and verbal communication strategies and the SOAPy documentation tool, the ability for me to write proficient nursing progress notes should become a reality. In addition, incorporating person-centered and family-centered care into the grief and loss framework will enable me to comprehensively address the condition of Mr. Perkins before transitioning him into aged care. Thank you for listening.